Okay, Mr. Jenkins, now I would like to start by asking some questions and doing a few simple tests just to understand a little bit more of what's going on throughout your body. Is that okay with you?
Yep.
All right, so first, would you mind taking off your shoes for me? And while you're doing
Of
that,
course.
I'm going to ask some questions. So, have you had any unexplained weight loss or gain lately?
No.
Any fever, chills, or sweating?
No.
Nausea, vomiting, or loss of appetite?
No.
Dizziness, lightheadedness, or falls?
No.
Any fatigue, weakness, numbness, or tingling?
A little weakness when I'm walking around
Okay.
the barn.
Okay, so on the uneven surfaces then?
Yeah.
Okay, any malaise or changes in cognition or mental activity?
No.
Okay, great. So now I would like to start by evaluating how well your heart is working. So first, again, I have some questions. Have you experienced any heart palpitations, chest pain, or heaviness?
No.
Any shortness of breath, coughing, hoarseness,
Mm-mm.
coldness or blueness of the fingers or toes?
No.
Okay. All right. So now I'm going to start by taking your blood pressure.
Okay.
And do you have an arm that you would prefer it taken on?
No. Whatever one works for you.
Okay. I'll do it on this one. I'll just move your shoes out of the way. So do you know what your blood pressure normally reads?
No, it's been a while since I got it done.
Okay. All right. So I'm going to pump you up, and it's going to feel a tight squeeze on your arm, and then I'll release the pressure. It shouldn't be painful, just a little squeeze.
Okay.
All right, so that was a reading of 120/80, which is really good. So nothing to be worried about there. All right, so now I want to take your heart rate. So if you wouldn't mind just slipping your wrist over for me. Great, and do you mind taking that watch
That's
off?
fine.
All right, so I'm just going to place my fingers here, and it'll be a minute without me talking just because I want to hear or feel your heartbeat. Okay, Mr. Jenkins. Okay, so have you noticed any edema or swelling in your body at all?
Sometimes my feet are kind of big after standing for a while.
Okay. Have you been standing much today? Because it doesn't look swollen to me.
Not too much.
Okay. Okay, so now I want to analyze your skin. So this is called your integument system. So just some overview questions. Have you had any rashes or other skin changes that you've noticed?
No.
Any new or changing moles?
No.
Sores that aren't healing?
Mm-mm.
Any changes in your nail beds?
No.
Okay. All right, so now I just want to look at the skin surrounding your right knee. So overall, the pliability and texture looks really good. It's not too tight or too loose or anything like that. And I do see a scar right here that must be from your meniscectomy.
Yeah.
Okay, and that all looks good. The skin color, again, looks really good, really similar to your other knee, so that's a good sign, and no lesions or cuts on it. All right, so now I want to analyze the strength and range of motion in your muscles. So again, just some questions. Have you had any joint pain, swelling, or stiffness aside from your right knee?
Not anything in additional to the knee.
Okay, any muscle wasting or weakness?
No.
Okay, pain that never changes?
No.
Okay, so your upper body, totally fine, no complaints?
Yep.
All right, great. So now I just want to start by looking at your hip, and I'll actually be looking at your ankle in addition to your knee. So first, can you mirror me? So just lift your leg up. Good. Let me know if there's any pain with any of these. Bring it behind you. Good. And the other side. Good. All right, and now can you out and bring it back in? Out and bring it back in. All right, and now I want you to take like the inside of your foot and bring it in, but the motion occurring at your hip. Good. And can you go out? Same thing on the other side. Good. So that all looks good to me. And now on your left knee, can you kick it straight out and bring it back in? Any pain?
Nope.
And let's try that on the right. Again, let me know if there's any issues.
It's painful.
Okay. Good. All right, and now we're gonna do the ankles. So if you wanna come up on your toes for me, good, and back on your heels, and then just bring your toes in and out. Good. All right, so now I'm gonna look at the strength of these. Okay, Mr. Jenkins, now I wanna take a look at the strength of your muscles. So we're gonna do the same motions that we did looking at the range of motion that you had, now just assessing the strength. So we're gonna start with your hip. If you wanna lift it up like you did before, good. And now I'm gonna try and push down and you resist me.
Okay.
Good. All right, and now you try and pull down towards the floor and I'm gonna hold you here. Good. All right, and now can you try and bring your leg out like this? Good. All right. Good, and now you'll bring it back into your body. Good. And now we're gonna do those rotation movements. Good, and the other side. Good. All right, now if you can kick your knee out like this, good, you can relax just a little bit. Now you try and kick up and I'm gonna hold you here. Good. Now you try and pull your heel back. Good. Now we're gonna take a look at the ankle. So would you be comfortable putting your leg up and resting it on
Sure.
mine? All right, good. So now try and bring your toes up, and I'm gonna push down. Good, and now you try and push into my hand. Very good strength. Bring it in. Good, and now try and push against my hand here. Good. You can relax that leg. Now it's like, okay, so now I want to look at the strength on this side, so we're going to do all those same motions. So first, if you want to lift your leg up, good, try and push down, and I'm going to resist. Good, and now you try and push up against my hand.
Okay.
Good. And now, if you want to abduct your leg, move it out like that, good. And I'm going to try and push you in. Good. And now you bring your hand in, or your leg in against my hand.
Okay.
Good. Now we're going to do those rotations again. So if you want to bring your foot in, good. And I'm going to try and push it out. Good. Now the other side. Good. So now I do want to take a look at your knee, but if anything is too painful, we'll definitely stop.
Okay.
So first, try and kick your knee out like you did before. Good. That's as far as you can go without pain?
Yeah.
Okay, so I'm gonna try and push down.
That's pretty painful.
Okay. Then we'll take a look at your knee flexion and extension. That's these movements later in the test for a formal evaluation.
Okay.
But while we're here, we can still take a look at the ankle as long as that's not causing you pain.
Okay.
So again, are you comfortable putting it up on my leg?
Yep.
Alright. So now try and bring your toes up to your nose. And I'm gonna resist. Good. And now push them against my hand. Good. And now bring it in. Good. Last one out. Good. Okay, we're on our last section. So this is looking at your neuromuscular. So a lot of the things that we're going to be looking at are going to be related to balance and coordination. So again, with the questions, have you had any coordination or balance problems lately? I know you said in the barn with the uneven surface.
Yeah, that's pretty much it.
Okay. Any changes in vision or hearing?
No.
Involuntary movements or tremors?
Nope.
And any severe headaches?
No.
Okay. So, Mr. Jenkins, how did you get here today? I know you're driving. Did you?
Yeah, I
drove
drove here and
Okay.
I walked in.
Okay. No problems with that?
No.
Okay, good. All right, so just sitting here, you look like you're doing really well, but just for safety purposes, would you mind picking this pencil off the ground just to test for balance? Good, and that looks really good. So because you are having some problems just moving about with balance issues, I just want to be careful. So I want to do a few more tests, but in order to be safe, would you mind if I put this gait belt on you?
That's fine.
Okay. All right, so if you want to lift your arms up for me. We want this to be pretty snug. How does that feel?
Good.
Good. All right. Tuck this excess in there. All right, and now, would you mind standing for me?
Mm-hmm.
All right. I'm just gonna tighten this a little bit more. Good. All right. So I'm just gonna ask you a few questions while we're standing here.
Okay.
So, okay, Mr. Jenkins, for our last test today, I just want to look at how well you're able to walk. I know you've been doing it a lot lately, but I just want to make sure that everything's okay. So I'm going to stand on your right side since that's where you're having most of your problems with your knee. So first, we can just walk over to this open
Okay.
space, and I'll just be here if you need me. All right, good. So now, if you wouldn't mind walking straight ahead towards the wall for me. All right, great. It looks like you're doing well with that.